welcome everybody to the qiCommunity Lunchtime Lightning webinar on today, Tuesday, November the 13th. It's just after 1 o'clock International Apple time and different times around the country. Check local guides. I'm Tony Lemke, I'm a GP in Austenville, Northern New South Wales, where there's a plane going overhead and it's a nice sunny day. We're joined today by Dr. Andrew Knight. Hello, Andrew.
Hello, Tony. Hi, everyone.
Andrew, would you like to introduce yourself?
Thanks, Tony. Yeah, I'm a GP primarily, so I've been in general practice for 30 years. I currently work at the Academic Primary and Integrated Care Unit in southwestern Sydney, which used to be called the GP unit, and we run a clinic, but we also do stuff to try and improve the integration of care in our region: research, teaching, and clinical service. Today
we thought we'd talk about attempting to reduce the time patients spend waiting in our practices for us. Andrew, is this important? Is this an important issue for patients? Should we do something about it?
Tony, I think it is a really important issue for patients. In fact, I think it's more important for patients than we realise. I mean, these are our workplaces and we get used to them and we get used to the way we do things. And I think we probably get a little bit desensitised to just the impact on people's lives of the wait. It's also, I guess, something that we sometimes feel we don't have much control over, and that can really, I think we have trouble perhaps addressing it because it's beyond our control. Interestingly, when we wrote the recent article for the Australian Journal of General Practice, we looked at some of the literature, and it emerges that actually when you survey patients, the wait in the waiting room is one of the most important things in terms of their satisfaction with their general practice. A European study of 10 countries, time in the waiting room was the thing that they mentioned as giving them least satisfaction. And it impacts on the consultation. Long time in the waiting room decreases satisfaction with the GP. So they're really important issues that I think we really need to face up to. And you and I were in a talk with the boss of the Productivity Commission in Australia, where he said that the loss of productivity related to waiting and waiting rooms, they estimate at $1 billion. That's in general practice and specialist and ED waiting rooms, $1 billion.
And Andrew, it also affects well-being as clinicians provide in the service. I know that when I'm behind with my appointment schedule, it creates that sort of pressure cooker atmosphere. And there's nothing quite like being in the zone where you're running on time.
I agree. Earlier on in my career, I used to regularly run an hour late, and it just created stress. And being stressed all day, every day, is an unpleasant way to work, and it does not need to be like that.
We shouldn't have to start every consultation with an apology. Which brings us, Andrew, we looked at, we collected 10 tips for helping doctors run to time, and we might run through those 10 tips if that's okay with you. Tip number 1 was about that question of culture or expectations. If you're 15 minutes late, I used to think, geez, I'm running on time, but in fact 15 minutes late does not mean that you're early.
No, that's right. And I think that's a matter of readjusting our minds in a lot of the evidence of patient attitudes to say, I'm actually going to run on time. So that'll have all sorts of implications. It'll mean you're actually there early enough to do stuff, all the stuff you need to do before you start seeing the patient. Are we desensitized to it? Do we think, okay, I'm on time now, I can have a break, so I run even, So there is self-care. I think you can't flog yourself and hate yourself for running late. General practice is unpredictable. We will run late. We have to give ourselves permission to do that. But psychologically, I think we need to commit ourselves to a culture where we are committed to being on time, and we organise ourselves to do that. I think it begins with that attitude. Have you gone, Tony?
Yes,
Tony's dropped.
Sorry, I've lost my webcam. I think I'm back again now, Andrew.
Yeah, we can hear you.
So as a quality improvement, we're hoping that our practices will consider, as always, improving waiting times a quality improvement initiative. And one of the things that some of our practices have done with this 15 minutes late doesn't mean you're early, is to start tracking doctors' starting times. You can keep a running tally in your waiting room of when the first doctor's appointment was at 9:30, what time he actually called the patient in. It's very hard to make up if you start late, and if you're used to being very late, then 10 minutes past 9, quarter past 9, 20 past 9 sometimes feels all right. Perhaps it is a quality improvement program to start tracking those times. The tip 2, Andrew, was about warming up, being prepared for the consultation.
This is something that really that struck me. You're running late, and then you run out of pathology request paper, so you've got to go out and find it, or and that happens over and over again. And I realised that if you do that in every 10 seconds in every consultation, half a minute in every consultation, it all adds up. That is a consultation that you've lost. 2 minutes in all 30 consultations, you're an hour late. Yeah, it just adds up. So you got to think, prepare for the day. Do I want a jug of water? I need it on the desk before I start. I need to look at the stuff. This is something that you can set a system in place. You can actually get the staff to say, is the room all ready to go? And you can do it yourself. Is your computer switched on and ready to go? I like to have a filing cabinet drawer with all the resources, and the classic one was the antenatal shared care protocol. Am I ordering all the right tests? You need to have that right to hand so you can pull it out and order the right tests at the right time. I think you can easily gain 15 minutes by being on the ball, prepared, warmed up, ready to go for the day.
Absolutely. And now, Andrew, tip number 3 is something we've covered in previous qiCommunity webinars, which is about working your diary. So knowing that some patients are going to be acutes or fit-ins, and knowing how many there will be on a certain day, identifying the acute stream and the routine stream, and not acting surprised when there are 53 fit-ins every Monday and 28 every Tuesday, being prepared for that in the way that our diaries are constructed.
Yep. Look, I think that's right. That's something that you and I have talked about a lot. There's actually quite a lot of thinking about this. You can measure how many people come in every day. You can measure how many appointments you've got, and that will then, you can measure how many acute appointments you need every day, and that will then allow you to plan so that when those acute appointments are requested, they don't make you late because you're not fully booked. You can read some of our articles about that. They're referenced in this article. But there's some simple things that we can do, and something that absolutely revolutionized my working day was to simply block out the right number of appointments every day. And for me, that was about 30%. So I would block out maybe 7 appointments every day, and that helps me to run on time, because I know there's going to be that kind of acute demand. It does blow your chronic weight out, and that's a bit what Tony's talking about, because he's talking about the different streams, and you can think about that. There's some people who need an appointment when they can plan it. There's other people who need the appointment today. They're kind of 2 different streams. So I think a really great rough rule of thumb is to think about that 30%, which means that then you're not trying to double book and fit people in or squeeze people in, because there really isn't any such thing as fitting in and squeezing people in, because time is time. And there's a lot of strategies for handling that acute demand, particularly because that's what we often neglect to handle. Many practices, through the collaboratives, we learned run this Jeopardy doctor system where, if you've got 4 or 5 doctors, one doctor at any given time is there to accept the acute people. People with an acute issue usually don't necessarily need to see the doctor who knows them very well. Whereas people with a chronic condition, it's much more efficient for them to see the person who knows them well. So having the Jeopardy doctor system can make a big difference. Some of these things are whole of practice systems, I know, but some of them are under our own control. Certainly in our practice, I was able to just get them to block out my 30% every day, and that works really well for me.
All right. Thanks, Andrew. And tip 4 is about, if there is some waiting time, making it productive. Andrew, how do we wait the wait?
Tony mocks my title of tip 4. Look, it is time, it's dead time in one sense, but can you take advantage of it? If you've got a practice nurse, can that person take a blood pressure, collect and test urine, perhaps organise request forms, perhaps do some of the things required for the diabetes check, so that when they get into you, you don't have to do those as the GP, and that saves you some time. Can you increase your patient's ability to self-manage during their time in the waiting room, which means that they can then not need to come so often? It's a long-term strategy, but clearly it's a useful time. Wait the wait, you know, get some more value into that wait time.
So Andrew, our next series of tips is about what we do during the consulting. And you talk about the golden minute, and we had Larry Baker in our previous webinar who talked to us about helping our patients in improving their lifestyle. But one of his great tips is to have a 10-second meditation before you call each patient in, to think to yourself, what will this patient need today? How can I help them? What are their particular attributes that I know about? Just breaking off from the previous patient and preparing your mind for being as helpful as you can for the patient to come, forming a bit of a break in your consultation thinking and allowing yourself to be prepared for the patient coming in front of you.
Yeah, this is really about how we consult. And yes, I think the thinking before the consultation begins about how, you know, clearing your mind, doing your housework to prepare yourself for the next consultation can make you more efficient in the consultation. You're less distracted, so you actually consult more efficiently and your time is better used. And I guess this tip is really about the whole art or science of consulting and constantly improving the way we consult. And we know that the first few moments of a consultation are absolutely key to the efficiency of that consultation. This refers to the idea that getting our non-verbal cues right can really make a big difference. So eye contact, using a patient's name, warm vocal tone, a smile, the body posture you use can make a difference to how the consultation goes. And more, it can make it more effective and more efficient. And so if you're constantly improving your ability to consult, you will run more on time. And so one of the things, the description of the Time Lord is, yes, running on time, but also not appearing rushed. And that's all part of our consulting skills as well, the ability to attend to the patient in a way that they feel attended to, and that you get everything out at the right time is absolutely key. So that's the idea of the beginning of the consultation. So we're not hearing you, Tony? Yeah.
Thanks, Andrew. The next tip was about, and this is a very important one, of what can we do for today, getting that patient's agenda and getting their full list up front. Is there anything else? Is there anything else? Find out everything you'll be dealing with.
Yeah, look, in my GP registrar teaching days, I think this is the thing that registrars, one of the most important things I could teach a registrar was the idea of getting the agenda out at the beginning of the consultation. So remaining silent until the patient's finished speaking. Seems like it's counterintuitive. You think they'll just go on speaking, but in fact they don't. Most patients will stop speaking by 60 seconds, and almost everybody by 150 seconds will have stopped speaking. And then you've got the patient, most of the patient's agenda, and then asking, you know, was there anything else you wanted to cover? That allows you then to see what you're hoping to address in that time, and then you can think, well, does it fit with our 15 minutes? Maybe not, or maybe we can address this and this quickly, and the nurse can address that quickly. So it allows you to plan. The other major breakthrough that it took me about, must have been about 20 years into my career before someone, Michael Greco actually, who many of you may have heard, I actually introduced this tip, and that is to say, once you've got that list, to turn to the patient and say, now, of these 8 things, which are the ones that you don't want to leave here today with them unaddressed? What's most important to you? Now, they might say, well, I must get my driving medical done, that's fine. And you might say, well, okay, that's fine, but I'm actually most worried about the fact that you've had chest pain since midnight. So, you know, you have your own agenda, you have a right to your own agenda, and you need to include it in terms of prioritizing. But that prioritizing question really allows you to provide value to the patient. They walk out feeling like that their needs have been met, and also allowed you to then maybe reorganize things that are further down the agenda. I find that has absolutely revolutionised my consulting and my on-time running.
And you'll know you've made a blue when after spending 10 minutes looking at a patient's mole, they tell you, now doctor, what I'm really here for, ... That's what happens if you don't get that agenda up front. So if you do get the agenda up front, you can often find that you can deal with all 8 things by allocating them the appropriate length of time, or as you say, using the nurse or other people to do it. So by getting the agenda, you can deliver better value for the patients by max packing, by allocating your time appropriately. If you don't have the agenda up front, no chance.
Yeah. It's interesting, the Canadians identified this, and they ran, I remember reading about a project they ran in Canadian, one region in Canada, where they actually said to patients, you can only talk about one thing. You go to the GP, only raise one thing. I actually think that's a disaster. It's really annoying to patients. And guess what? They've then got to come back and have another appointment. So you actually blow your capacity tomorrow or next week or whenever they come back to deal with the other thing. If you can deal with as many things as you can at that time, then yeah, it makes sense. So that getting the full agenda out and dealing with as much as you can is really important. We'll come to that a bit more later.
Yes, you don't really want people to come back if they don't have to. Andrew, the red zone is an American concept of the doctor being the rate determining step in making sure you're running on time, and the rest of the practice does everything they can to assist the doctor to running on time. So if your sign of people not being in the red zone is walking up and down the corridor looking for the otoscope or the Doppler to listen to the baby's heartbeat, or has anybody seen the cryo machine? Doctors doing non-doctor things, doctors chasing up paperwork. Really, if we're going to run on time, we have to concentrate on the red zone.
It's a helpful concept that our time is high value and precious. It's important to think it through about time that you're wasting on unimportant things. I remember having a conversation with a GP about this, saying, but when you're taking the blood pressure and you're weighing them, isn't that a time when you're actually building your relationship? And he said, well, I'm much better off talking to them about initiation of insulin or other things that I can do than weighing people and doing blood pressures. And I had to agree. He actually said it gave me more time to do important things like talking to them than doing these tasks. So really thinking about the use of time and that red zone, I think it's a very useful concept. And also we do waste people's time. Even the way we structure our waiting room, the way people have to wait to get registered, all sorts of things. It's worth thinking about red zone for patients for their sake and wasting their time.
So Andrew, Mark Murray, the doyen of Access, says that the value in general practice is the relationship between the doctor and the patient. And because all your patients end up dying, he says, so it's the relationship between you that is the most important thing. And the value is the time you spend talking about important things with that patient, giving them a richer, more meaningful life, allowing them to develop. And the rest of the time where you're walking around and doing unnecessary things is wasteful, because that other time is so important. So we want to be in the red zone. Andrew, here's you can also harness the enthusiasm of the patients for you running on time, and you've developed many years ago the famous 12-minute slip.
Yeah, this is something that really helped me. It actually came from when I was first starting to learn about quality improvement, and someone used the 5 whys on me. I don't know if you've come across 5 whys. It's a way of getting to the root of a problem where you ask why 5 times. So my problem was I run late, and they said, why? I don't know. Consultations just run over. Well, why do they run over? Oh, we keep talking too long. Why do you keep talking too long? Well, I guess, I find it hard to interrupt people. Why is it hard to interrupt people? Well, it seems rude to interrupt people. Why does it seem rude? I don't know. I think they want to go along. And we worked through it. It came to the point of realizing the biggest problem was that I didn't want to interrupt people. And the solution we came up with was that we should tell people how long a consultation was, so that it wouldn't seem like I was interrupting when I said we needed to finish. So we invented this slip, and I gave it to everybody for 2 weeks, and it halved my wait time, because I found patients would start to look at their watch at about 12 minutes and say, you'd better finish, you've only got 12 minutes. So it says, it's annoying for patients and stressful for staff when we run late. We're keen to fix our lateness. And one of the problems is we're running over time. Just 4 minutes per extra consultation means the doctor's 1 hour late at the end of the morning. You can help by being aware you've got about 12 minutes, being understanding if the doctor suggests you come back. For me, it was effective for my particular reason for running late. And other people have said it's been useful as well. So we thought we'd put it in there. It's a way of harnessing the patient. One little wrinkle to this is I know now that there's online booking, I always tried to get the receptionist to say, oh, yeah, okay, I've booked you for a 12-minute consultation with Dr. Knight, so people know it's 12 minutes. But that didn't work. So that's why I gave the slip. But now with online booking, you get a little message when you online book, and you can actually tell people every time they book, it's 12 minutes. So that's another option, I think, that you can think about.
And so the patients, once they're engaged in the process, were a great ally and to help you run on time.
Yeah, they were kind of sorry for me, and they would help me to run on time. Which I
better get going now, Dr. Knight. Stop babbling on. I've got to get going. Yeah. There are more people to come in.
Exactly. You're running late. We've got to go.
So, Andrew, despite harnessing the patients, waiting the wait, working your appointment book appropriately, getting the agenda right, you can still, max packing, you can still find yourself running late. So we get to the point where our appointment systems need to reflect the truth. You've got to dance with who you brung.
Yeah, I don't know if this was your idea, Tony, but it's a neat idea. If you always run half an hour late at the end of the day, and it's completely predictable, and so, you're supposed to finish consulting at 5, but you always finish at 5:30 with your last patient, what's to stop you blocking out the 3 p.m. patient and the 3:15 p.m. patient, just block them out, make them unavailable for booking, and then just add another 2 at 5 and 5:15. So then, at least for most of the day, you're seeing people at the time that's predicted. It's a good idea. It's facing up to the reality and manipulating your diary to fit it. Yeah. Another interesting idea.
Yeah, so it's good. So we do that for the registrars, don't we? When they start off in the practice, we book them 2 or 3 an hour. But if I'm always seeing, as you say, my 4 o'clock patient at 4:45, and that's predictable, then let's put some extra blocks in so that we're still seeing the same number of patients, but instead of the 4 o'clock patient turning up at 4 and waiting for 45 minutes, they'll get there at 4:45, and I'll be relaxed, they'll be relaxed, we're running on time, we won't be. So after you've done all these other 9 tips, if you're still predictably running late, then you can have some truth in advertising and rearrange your days so the same number of patients would spread out over a longer period of time. Andrew, so we remember in the Canterbury Health System, their motto when they tried to galvanise all their health professionals into improving and redesigning the system, the motto they came up with was, "Don't waste people's time." So it's really something that I think that patients understand, that there are circumstances in which doctors will be running late. We need to sometimes give patients more time than we expect. That's understood and normal, but we can do that even better if we can take these measures to make sure that we're Time Lords. One of the doctors in my practice, patients are in and out fairly quick, smart, and they always come out saying, "He's so thorough, isn't he? That Jimmy, he's so thorough and so excellent and so comprehensive." And I think, what a bugger. Here he is. He's quite quick, but patients understand that he's efficient. And other doctors might faff around a bit, and patients know that. So we want to stop the faffing around and be a bit more like Jimmy, I suspect, and become more Time Lords like some of those other, some of our colleagues seem to be.
Absolutely. It's been a lifelong project for me, and I'm running better on time these days.
So, Andrew, we'd be keen to hear from our attendees today if they've got any additional tips for people who are trying to stop wasting people's time and run on time themselves. We'd be interested to know people's own experience in decreasing their waiting times. We're always keen to learn, and we could add that perhaps to our next article on becoming a Time Lord.
Yeah, so maybe if people want to write comments in, or I don't know if you want to unmute people now, Sarah, if people want to actually speak. We've got 26 people.
Yes, I can unmute people if they just hit the little raise your hand icon, then I can unmute you. Okay, Chris, I'm going to unmute you now. Thank you.
Thanks. Yeah, I just was having some trouble typing my message in. Hello, Andrew. Hello, Tony. Fantastic tips there. One thing that I've come across and started doing, it's a little like your pre-planning, is having a huddle in front of the list with a nurse or receptionist, seeing who's on the list for the day and thinking, okay, I've got Andrew coming in. I know that he's going to actually take a bit of time. How about you grab Andrew, weigh him, do the blood pressure, get his list of him. If you could document the list before I see you, then that will actually save me some time. Because there's always, you can always look at your list and think, who could be a blocker today? Only from past experience, but then you can actually share that across the team, and that huddle working through the day only takes 5 minutes to think about who's on the list today. So that's a little thing I've been practicing.
Nice.
Yeah, thanks, Chris. I think those huddles are something we should do much more of in practice. We now work with on our acute days. One nurse is responsible for managing the acute flow, and we have a huddle at the start of the day to determine how busy it is, what are the, just as you say, and that's been an effective strategy for us. Having nurses keep us flowing and running to time, and often, for instance, if patients coming in and it turns out they've got a urinary tract infection, by the time I see them, the form's printed out, the urinalysis is done and available to me, the prescription's just about printed out. Patients appreciate it, and it really can keep me in the red zone and improve our acute flow. And I can spend more time with the patients on giving advice and relationship building. Well, that's our time for our, thank you, Chris, for that comment, and that's our time for our lunchtime lightning webinar. Sarah, what's coming up for future? Thank you, Andrew, and thank you, Chris, and thank you to all our participants today and to all of those who've joined us throughout the year. I know we see the same names every month, and we really appreciate your support. This webinar has been recorded and will be made available, and both as a webinar and in future times as a podcast. Sarah, what's coming up?
Well, this is the final one for 2018, like you said, Tony. So please look out for us next year. Thank you, everyone, for all your support, and in particular yourself, Tony, for supporting myself and qiCommunity throughout the year. So I hope everybody has a wonderful Christmas break, and look out for the newsletter. We are also trying to tweet when we have qiCommunity webinars. So please look out for it all, and we will see you all next year. Thanks so much. Thank you, Andrew. Thank you, Tony.